Let's talk about your dental exam. This is the most important procedure that is done within our dental practice. Why? We use this opportunity to gather data about your mouth. We use diagnostic tools like x-rays and photographs and visual cues like examining inside your mouth to understand what is happening. Your mouth and oral cavity have implications systemically, so we need to understand what is happening in your mouth, what is happening in your body, and how these two interface with each other. So let's talk about what a routine dental exam looks like at Ponce Dental Studio. When you come in, we want to gather as much information as possible. So we're taking extraoral photography, we're taking intraoral photography to capture the shape of your teeth, the shape of your smile, and just to understand overall what you look like. We're then using X-ray technology to really understand what's happening inside of your teeth. We're taking a CBCT scan to understand what's happening in your TMJ joint, what's happening in your bone, making sure there's no cysts, making sure there's no bone cancers, and making sure that overall you look very healthy in that area. Then the hygiene team with their assistants come in and do a periodontal assessment. We measure the heights of your gums. We go ahead and document any existing restorations you have. We go ahead and measure around your gums to ensure that the gum tissue and the bone are supporting your teeth correctly. And then we go ahead and prepare the information needed for the dentist exam. By the time I come into the operatory, I'm able to see the photography of your teeth, the photography of your smile, the CBCT scan that shows your jaw in 3D, and also the x-rays that the team has taken. But wait, what we utilize is a technology by a company called Overjet. We were early adopters of this technology and helped actually shape what it does today for dentistry. And what is it? It is using artificial intelligence to look for patterns that could potentially be disease on your x-rays. It is a tool that helps me treat you better. Why? When the Overjet technology identifies something in your teeth, it's generally right 99.99%. Yes, more than the average dentist. That is a diagnostic tool that I want in my corner to help me assess what's happening in your mouth so that I can provide you the best care possible. So I start my intraoral examination with my mirror, holding my gloves and looking inside. The first thing I'm doing is I don't care about your teeth. I care about your soft tissues. I care about your tongue, your cheeks, the roof of your mouth, underneath your tongue, the back of your throat. I want you to say, ah, and I want to look. Why? We're looking for any lesions. Oral cancer is the killer. Generally speaking, people don't die of a cavity, but they do die if you have squamous cell carcinoma on your tongue undiagnosed. And so I'm visually looking for the changes that are abnormal and ensuring that I've got my eyes on every nook and cranny of your mouth. Then I'm going through your individual teeth, I'm assessing their health, and I'm making recommendations from a dental health standpoint. Well, wait, I don't want to stop there. I don't trust my eyes. I remember Mrs. Bodner, a patient of mine about 8 years ago, where visually everything looked good, but there was a cancer on her tongue. And even though I looked that day for it, it was so undifferentiated that I couldn't tell it apart. And only after the fact that she went to an ENT and was diagnosed and went through surgery and did well, did I realize that there's shortcomings when it comes to the naked eye. And so we utilize a tool called the VelScope. And the VelScope emits a ray of light that anything that is precancerous or cancerous absorbs, and within the little beam and scope that I look at, I can actually see the difference between healthy cells in gums and unhealthy cells in your gums, and I'm able to identify things that are precancerous or early in their cancer cycle. What does that allow us to do? Catch it early. And in cancer, when you catch it early, it makes all the difference in the world. And so during this examination of us looking at your smile, looking at the aesthetics, looking at the teeth, we want to make sure we look at your gums, we want to make sure we look at all your soft tissues, and we're looking for disease as a whole. And anything we see, we diagnose, we educate, and we make sure we put a plan together to fix you. But those are the important things that happen in an exam, and I wanted to spend a few moments with you to talk through that.